About advanced directives. These are great ways to make sure that your wishes are carried out if you can't tell the doctors yourself. So the big question is, how do you make sure it ends up in the right hands? Sue Ellen Grounds is here to help answer that question for you. She is a palliative care clinical nurse specialist at Cone Health. Good morning.
Good morning. Thanks for having me.
You know, an advanced directive is something that all of us should have and really need to have it at some point in our lives.
Absolutely. We actually recommend that folks have them done when you're not sick. The best time to make those decisions are when you're not in a crisis and you're not ill. You can talk with your family, and sometimes it can even be, dare I say, a funny discussion, because you can actually you know, find out what they want and what they feel about those decisions near end of life.
You say funny because I do joke with my children, this is what I want, and if you don't do it as I want, I'm going to come back and haunt you.
Yes, yes. And so those are the regular times. But when you're in a crisis and you're at the hospital, it's perhaps hard. In the ED, it's very hard because your thoughts are racing about a lot of other things.
Yeah.
So
let's talk about what an advanced directive is and what it includes and should include.
So in North Carolina, an advanced directive involves two pieces of paper. The first one is the healthcare power of attorney, and that is the person that you designate to speak for you should you become unable to speak for yourself. So that person doesn't speak for you at all times then when you become sick, and that's misunderstood often, especially in our senior population, but that person only speaks when you become unable to speak for yourself. The second part of the advanced directive is the living will, and that's where you can specify code status, artificial feeding, artificial nutrition. Do you want to be on a ventilator for a long period of time should the doctor determine that your medical condition is irreversible? So it goes into a little more detail.
So who needs to get a copy or be in you know, control of this or have it in their hands?
Well, once you get the copy, once you get your paperwork filled out and it's notarized, then we recommend that all of the folks that helped you within your family to fill that out, that they get a copy, that your physicians get a copy, including subspecialists. So you have a primary care physician, cardiologist, pulmonologist, and that you give it to them so they have it on file. But here in Cone, we've been really fortunate. We have partnered with a group in the community called Mind My Health, a not-for-profit group. Just very recently launched a digital a website where the documents can be digitally uploaded.
Awesome.
So you don't have to carry around a piece of paper, and then it is actually on the net, and you can have any one of your providers or family members access that.
And that works great because you don't have to have that physically with you. You can pull it up. You know, a lot of us have smartphones, and you can pull it up on the smartphone and show it to you know, that provider.
We have that issue a lot where we ask folks, do you have it? But in a crisis, again, well, it's in my safety deposit box, it's at home in this box, and we don't have access to it. So then we really, as healthcare providers, can't look at it and actually disseminate what the patient's wishes are. And that really is our goal, is to make sure that we are doing exactly what our patients and their loved ones expect from us and want from us during those crisis situations.
Awesome. Well, again, it's mindmyhealth.org. Okay. Mindmyhealth.org. You can fill the papers out on that site, and they will be on there digitally for you. If you have your paperwork and you know how to scan them, you can scan them into a file right there on that site yourself. Awesome. Awesome. Thank you so much for being here this morning. You can find out more by going online to conehealth.com/advanced directive. For other tools and resources that promote a healthy lifestyle, go to conehealth.com/wellness-matters.
House Call on Fox 8 is sponsored by Cone Health.